the tips that you must have to prevent a misdiagnosis. After 7 years, Nancy Davis was finally diagnosed with MS and has been a world-renowned advocate ever since her diagnosis. A few days ago, she met with Debbie, who was recently diagnosed with this disease as well.
A few years ago, it started off as a tingling sensation in the left side of my face, and it just started growing and got worse. I went to the doctor and we ran a bunch of tests, and he finally just said it might be multiple sclerosis. I was terrified. One of my biggest fears is not being able to walk and being in a wheelchair. It's been 3 months since I've been diagnosed, and my children don't know. I don't know how to tell them that this is going on. I'm scared for them, and I don't want them to worry. I don't know if that's a form of denial, but I'm very scared. I have a lot of unanswered questions, and it's a daily struggle to try and deal with it. Hi.
Hi, Debbie, I'm Nancy.
Nice to meet you.
Pleasure to meet you. I know, you're scared. Oh my God, and I was in your shoes. What are your biggest fears?
My biggest fears are that I'll just not be there for my kids the way I want to be.
I had 3 children too when I was first diagnosed, and I know that's the thing that scared me the most. What have you discussed with your children about your illness?
I don't know how to tell them. I don't want them to be scared.
Sometimes by not telling your children, they're probably 10 times more scared than they need to be. You know what, you're doing your kids a favor by really leveling with them. It's important to be really honest. I'm going to give you this little journal, and I'd love you to write down in here all of your fears. When you can identify everything you're afraid of and look at it, it's easier to overcome your fears. You owe it to yourself to embrace change. Your life is never going to be the same as it was before, but it might be better.
I can do that.
Nancy and Debbie are here today along with neurologist Dr. Ari Green. Welcome to both of you. So, Debbie, the visit from Nancy was helpful?
It was very helpful. It made me know that I wasn't alone in this, and that looking at her, she's amazing, and that I will be okay.
And Dr. Green, you are a neurologist. You deal with MS quite a bit.
Right.
Explain, and I think we have some MRIs, the structural changes that take place in the brain.
So Travis, what we're looking at here is an MRI from someone who has MS. And these are sections of the brain taken down this way. And what we can see is there are these white spots that shouldn't be there, that are in the area that we refer to as the white matter. And those little spots represent areas which could be edema, they could be inflammation, or this could be a scar tissue from the multiple sclerosis. And those spots there, if we go to the next slide, we can see a close-up that are characteristic or particular distribution that we tend to see with MS. But also these black areas in the middle that are in everybody's brain, they're different in patients who have MS in that sometimes there's atrophy or shrinkage of the brain that occurs with time because of the injury that goes on with MS. So what we have now is the opportunity to use drugs that have been approved by the FDA. We refer to them as the ABC drugs. They're all largely injectable medications that patients take, and what they can do is help turn the thermostat down on the inflammation to reduce the amount of inflammation that's going on in a patient's brain. And that's the goal with the therapy, is to prevent the inflammation and the injury early so that we can make a difference over the long term.
And Nancy, you have had a particular treatment that's been helpful?
When I was diagnosed, none of these drugs existed,
Right.
and I needed to figure out how to get better in light of that there was nothing. And I've really gone the homeopathic route, which is not necessarily right for everybody else, but it has worked for me. Whenever I have an attack, I go to a homeopathic doctor, and they give me supplements of what my body seems to be lacking.
And all of this brings us to our next item on our checklist as far as preventing a misdiagnosis. You have to talk to more than one doctor if you don't get an initial diagnosis. Getting a second opinion is always smart. One of the things we did do for Debbie is, since millions of people with MS do look for new and improved alternative therapies to treat their symptoms, we wanted to send her for an alternative therapy. We sent her to a holistic integrative MD to see which alternative therapy might help her.
I practice holistic and integrative medicine. We use a lot of natural remedies in this practice, but we work hand in hand with the conventional docs. One of the things I really want you to do is to work with your diet. Eat organic because you want to reduce any pesticides, hormones, metals that might be in the food. Fish oils calm inflammation. Fish oils would be very important for you.
I would definitely be willing to try that.
Exercise is very important with moderation. Don't let yourself just get stagnant.
The last time I did it, my whole entire hand went numb.
You want to be careful about generating too much body heat. So saunas are not a good idea for you. Hot tubs are not a good idea for you because that can actually bring about flares.
I'm open to anything that will make me feel better.
What I'd like to do now is I want to do a physical exam on you, and then after that, we'd also want to give you intravenous IV infusion of vitamin C and glutathione. Vitamin C is an antioxidant, but it also helps to support the immune system's proper functioning. Glutathione is an antioxidant that helps protect you against inflammation. These are all part of a more holistic approach.
I'm really looking forward to starting and trying to feel better. And I think that I'm on my way.
How was your experience?
It was great. It was nice to learn about the different ways you can treat it and what you can change in your everyday life to make things better and easier.
And that's the most important thing is every day you can take action on your own, being active, eating a healthy diet.
And everyone has a different course with MS, so that's why it's good to have a doctor involved who's an expert in the area who can help advise you about how things are going and keep monitoring what's going on.
And Debbie, best of luck to you.
Thank you so much.
Thanks for being with us. Thank you.